Good morning, and welcome to the Osher Center for Integrative Medicine Network Forum, Learning Vertically and Horizontally. My name is Peter Wayne, and I serve as the director for the Osher Center, which is jointly based at Brigham and Women's Hospital and Harvard Medical School. One of the key missions of our center, which since 2010 has been structured as a center without walls, is to bring together people and their ideas from both within and beyond the Harvard Medical School and Greater Boston area, to catalyze dialogue and collaboration in integrative medicine research, clinical care, and education, and to help build and support our integrative medicine community. One means of connecting and strengthening our community has been through our integrative medicine forums, which take place approximately every 2 years. Given the extraordinary levels of social distress and isolation we have all endured over the past 9 months, I cannot think of a time when I, and I imagine most of you, would be more elated by the idea of convening in person to catch up with old friends, make new ones, share ideas, and to empathize with one another around the professional and personal challenges we have all endured. Unfortunately, due to the ongoing COVID-19 pandemic, convening in person this year is just not possible, but I'm hopeful that the rich, thoughtful, and socially relevant program we have planned for you, along with built-in opportunities for breakout sessions, special interest groups, and panel discussions with question and answer periods, will facilitate some sense of a community. On the upside, the use of a virtual platform has expanded the reach of this event significantly and to a much wider audience. As of this morning, we counted over 670 registrants, with many joining in from far beyond Boston, including Cameroon, Saudi Arabia, Indonesia, Korea, Japan, China, Brazil, Chile, and Canada, to mention just a few countries, as well as from across many states in the US. Aligned with the spirit of integrative medicine, we're also pleased to have attracted a rich mix of participants, including researchers, educators, and a great diversity of clinical providers, including physicians, nurses, physical therapists, acupuncturists, chiropractors, nutritionists, psychologists, and mind-body therapists, just to mention a few. I welcome all of you, along with the many patients and users of integrative medicine that are also joining in today. So in prior years, our forums have centered on integrative medicine research and models of clinical care. But this year's forum is centered on education. In particular, we'll explore how integrative health and medical education can play a leading role in addressing 3 critical issues within healthcare today. The first issue we will explore is healthcare provider resilience and well-being, and the need to not only provide tools for providers at all stages of their training, from students to established providers, but also the importance of systems-based thinking in addressing the largest stigma of burnout, depression, and other mental health sequelae amongst healthcare providers. The second issue we will explore addresses the critical need for interprofessional practice and education training. We will learn about why it's more important than ever for providers to learn to work better across different healthcare disciplines. Addressing barriers to interprofessional care not only gets at the heart of integrative medicine, goal of treating the whole person, but also has implications for healthcare economics and policy. The third set of issues we will explore relates to diversity, equity, and inclusion in medicine. The COVID-19 pandemic and the recent tragic deaths of George Floyd, Breonna Taylor, and many others have shown light on a long-standing history of racism and inequity in medicine. We will hear about emerging dialogues brought to the fore by these tragedies and how they are catalyzing educational initiatives targeting all members of our medical community, while also addressing key structural changes that underlie injustices. But before getting too far into our program, some practical housekeeping matters. Today's event is running on SpotMe virtual event platform. I trust you have begun to explore some of its features. If at any time you have a platform or programmatic question, please use the support tab on the left side navigation bar, where you can leave a comment and our team will get back to you immediately. And if you have not done so already, and you want to update your profile, simply click on your name in the upper left-hand corner, and then you can make the changes that you wish to accordingly. I also want to take a moment here to acknowledge and thank the generous sponsors that have helped make this event possible. And these include the Weil Foundation, the Brigham Education Institute at Brigham and Women's Hospital, the Benson Henry Institute for Mind-Body Medicine at Mass General Hospital, the Li Kun Sheng Center for Health and Happiness at the T.H. Chan School of Public Health. And I especially want to acknowledge the continuous and ongoing generous support and vision of the Bernard Osher Foundation. So now it's my distinct pleasure and honor to introduce Dean David Golan, who on behalf of Harvard Medical School and its affiliated hospitals and institutions will welcome you and provide some brief introductory comments. Dr. Golan co-chairs the Oversight Committee for the Osher Center and has been a remarkable supporter of our center's mission, and personally for me, a very generous counsel and mentor in my leadership role. Dr. Golan is the George Minot Professor of Medicine at Harvard Medical School and was appointed Dean for Research Operations and Global Programs in 2019. He previously served for 11 years as the Dean for Basic Science and Graduate Education and Special Advisor for Global Programs. He's a professor in the Department of Biological Chemistry and Molecular Pharmacology, where he maintains an active research laboratory, and he also maintains an active medical practice. Among many other responsibilities, Dr. Golan oversees planning, implementation, and oversight of interdisciplinary, interdepartmental, and interinstitutional research initiatives at the Harvard Medical School, including the Osher Center. So without further delay, please join me in welcoming Dr. Golan.
Good morning, and thank you, Peter. I'm delighted to add my warm welcome to this wonderful network forum on learning vertically and horizontally, hosted by the Osher Center for Integrative Medicine at Harvard Medical School and Brigham and Women's Hospital. I would like to briefly recount the transformational collaboration between Harvard Medical School and the Bernard Osher Foundation. Now approaching its 20-year anniversary, our Osher Center is one of the longest standing and most impactful integrative medicine centers in the United States. In 2001, the Osher Institute and the Division for Research and Education in Complementary and Integrative Medical Therapies were founded at Harvard Medical School as the result of a generous gift from the foundation. The Institute and Division were founded and led by David Eisenberg, a visionary faculty member at Harvard Medical School and the Harvard School of Public Health. In 2007, the Osher Foundation generously provided a second founding gift, this time to Brigham and Women's Hospital, to establish the Osher Clinical Center for Complementary and Integrative Medical Therapies. This center has been expertly led for the past 13 years by Don Levy. In 2012, these two terrific entities came together with a new vision to form the Osher Center for Integrative Medicine at Harvard Medical School and Brigham and Women's Hospital, and a national search found the perfect director in Hélène Langevin. The new Osher Center was and still is a center without walls, with a mission to form strong links for integrative medicine researchers, educators, and practitioners throughout Harvard Medical School, Harvard University, and the HMS-affiliated teaching hospitals and research institutes. Dr. Langevin embraced this vision with a passion and implemented it at a furious pace. She rapidly built and consolidated our integrative medicine community and developed education, research, and clinical programs across the spectrum of biomedical science and medicine relevant to integrative medicine, diagnostics, therapeutics, and prevention. In fact, Dr. Langevin was so successful that she was recruited to the NIH in November 2018 to head the National Center for Complementary and Integrative Health. And that brings us to the present day. After masterfully filling in as interim director of the Osher Center for Integrative Medicine during a national search for Helene's replacement, Peter Wayne was recently appointed as the new director of the center. And if anything, Peter's vision is even more exciting since it builds on Helene's work to establish our magnificent center without walls. Stay tuned for Peter's strategic plan for the center, which he will be developing over the coming year, together with his colleagues throughout the Osher Center. I would like to make a couple of observations about the terrific research and education being done in the Osher Center for Integrative Medicine. The center's mission is very well aligned with that of Harvard Medical School and the Brigham and Women's Hospital. Perhaps the most important and prominent attribute of the center is its commitment to rigorous research, which spans the translational spectrum from fundamental research on basic mechanisms to clinical research, clinical effectiveness, and implementation. This research not only informs the evidence-based interventions delivered to our patients and is disseminated broadly to our providers and policymakers. Importantly, it also enables bridge building across departments, disciplines, and institutions across our integrative medicine community. The collaborative and interdisciplinary research led by the Osher Center's faculty and supported by mechanisms such as the Center's pilot grant program have high potential for innovation and impact. Please allow me to express what a great pleasure it is for me to see all of you here today, even if virtually, our community of integrative medicine. Represented today are basic translational and clinical scientists, clinicians, and teachers across the spectrum of integrative medicine. Heartiest congratulations to Peter and to all of you for making this event happen. I'm very much looking forward to our exciting day ahead. Especially notable are the timeliness and relevance of this forum's main topics, including resilience, burnout, interprofessional education, and racism, equity, diversity, and inclusion in medicine. Finally, I want to express my personal gratitude and that of Harvard Medical School and Brigham and Women's Hospital to the Osher family, not only for their gift, but also for their vision. As we will see today, integrative medicine brings an important voice and set of tools relevant to the practice and culture of medicine and patient care. Thank you very much and enjoy the day.
David, thank you so much for your thoughtful words and also your ongoing support. So we have a very full day planned for you, so I want to provide you with a little bit of an orientation. So there are three themes this forum will be addressed, this forum will be addressed through three keynote lectures and ensuing panel presentations and discussions. I'm so very grateful to and thrilled by the truly remarkable lineup of leaders and scholars that will be presenting. Today promises to be a really special day. Our first session this morning will address the topic of healthcare provider resilience and well-being. And the keynote lecture will be delivered by Dr. Michelle Williams, Dean of the Harvard T.C. Chan School of Public Health. Dr. Fidencio Sadania, Harvard Medical School's Dean for Students, will provide some additional comments and participate in a panel discussion led by Osher's Education Director, Dr. Darshan Mehta. After a short break, our second session this morning will center on interprofessional practice and education. And the keynote lecture will be delivered by Mary Jo Kreitzer, who's the director of the Bakken Center for Spirituality and Healing at the University of Minnesota. Other panelists include Dr. Louis Sportelli, a leader of multiple national efforts to elevate the status of chiropractic care in today's healthcare system, and Dr. Vitaly Napadau, a distinguished neuroimaging researcher and clinical acupuncturist based here at the Mass General Hospital and Harvard Medical School. Our third session this afternoon will address the topic of diversity, equity, and inclusion, with keynote lecture being delivered by Dr. Joseph Betancourt, who's the Chief Equity and Inclusion Officer at Mass General Hospital. Dr. Nawal Noor, who recently stepped down from the position of Chief Diversity and Inclusion Officer for Brigham and Women's Hospital, will share some additional comments as a panel member, along with a Harvard Medical School student. Each of these sessions will include an internal panel discussion, as well as an opportunity for some open question and answers from the audience. At noon, you're encouraged to grab some lunch and join one of the special interest groups, where group facilitators will provide an opportunity for networking and informal sharing of ideas related to a variety of topics. You need to register for these sessions in advance, so if you have not done so already, please sign up as soon as possible. Maximum capacity for each of these sessions is 50, and they're going to be offered on a first-come, first-served basis. So after another short break, you're then invited to attend one of our breakout sessions As they're all very interesting and relevant, I know it will be difficult to choose just one, but keep in mind, these will all be recorded and made available for post-conference viewing. And if you have not had a chance to do so already, during the breaks, we encourage you to peruse the more than 80 posters that have been submitted. At the close of the day, we'll be announcing the first and second place awards for best posters in both clinical and basic research, as well as in education. And for those of you wanting to apply for continuing medical education credits, this conference offers up to 5.75 AMA Category 1 credits. Each session, excluding the special interest topic groups, is eligible for 1 credit. If you'd like to request CME credit, please use the SpotMe platform and click Request CME and fill out the form with your information. If you're not planning to attend all day, please make your request after the last session you attend. I'm also required to formally announce that any possible faculty conflicts of interest are displayed here, and all have been resolved. Finally, we invite you to use the SpotMe platform to connect with and engage in spirited dialogue with one another. If you have something to say, please use the social feed feature to share your thoughts and connect with other attendees. You can also use the chat function to send private messages to other attendees. We hope that this dialogue results in new connections, ideas, and contributes collectively to shaping a new path forward in medicine.